Thank you, Donna. And David, it is so good to be here with you. And thank you to Research America for this wonderful event each year. Now, let's start with some basics. So, ARC is the lead agency for health services research, and Academy Health is the National Professional Association for those who produce this type of research and also those who use it to improve clinical care and policy. But our audience today may not have quite the grasp that you and I have after years at it on health services research, or HSR, and how it is different and why it matters to the future of healthcare and health in this country. So I often like to say that health services research is the science that studies the interventions to find out what works and for whom and under what circumstances, and also importantly, at what cost. And so basically, health services research is diagnosing diseases of the healthcare system itself. So given that, David, where does ARC fit into the bigger picture of health research?
So thank you, Lisa. And I love that analogy. I think at ARC, we not only diagnose what is ailing the healthcare system, we discover and test new treatments. So when I think about ARC, though, and what we do, three areas come to mind. We first generate evidence through health services research about how to deliver good care. And then we work to move that evidence into practice to improve quality and safety. And finally, we collect and analyze data to understand how well America's healthcare system is and sometimes is not working. At ARC, our research focuses on understanding how healthcare delivery organizations and healthcare professionals who work in them can best provide patients with cures and breakthroughs in treatment discovered through biomedical research. Our research looks at how healthcare can be more effective, safe, equitable, accessible, and valuable. Health services research itself examines how healthcare delivery is organized, structured, and financed to improve outcomes. And at ARC, we also work to ensure that healthcare professionals and the patients they serve have the best available information to help them make decisions together. And finally, we like to consider how technologies and new innovations, like we're discussing here at Research America, are going to be integrated into care delivery in the future to improve quality, safety, and value.
That's fantastic. And that's a lot of big dimensions of healthcare: quality, safety, costs. So let's get a bit more specific. Can you give me some concrete sort of examples of what you just described to make it a bit more real for me?
Happy to do that. So I'd start with one of our foundational areas of work, and that's patient safety. ARC's research in patient safety has over the years saved tens of thousands of lives and billions of dollars by preventing infections in hospitals. We all are better because of that work. But moving further, ARC's digital technology research, many people don't know, paved the way for safe and securing e-prescribing systems in the U.S. and also helped establish the first state-level health information exchanges. We also have a hand in health organization research that helped our hospitals decrease waiting times in emergency rooms, something I think we all can appreciate, and improve discharge processes for both patients and staff, which have resulted in decreases, national level decreases in hospital readmission rates. And finally, ARC's policy research, our policy-focused research, helped Congress decide a number of years ago to continue the CHIP program, to reauthorize it, leading to the provision of affordable insurance to hundreds of thousands of children.
Those are great examples, David. Yeah, very concrete. And as a pediatrician, I love that last example about the child health insurance program. That's what decision makers need, is really, what difference does it make? So given that scope of work that ARC funds and supports, how is the work of your agency complementary to the work of the NIH? And why does biomedical research, as perhaps is traditionally thought about, need health services research to cover what I like to say is the last mile of that journey from discovery to actually better care at the bedside in the community and better patient outcomes?
These are both important kinds of research, and I know you know that, Lisa. And here at Research America, we often get excited about the generation of new breakthroughs and cures. And as a person living with cancer myself, I'm also an advocate for these treatment innovations. So the work done at NIH and by others to develop vaccines and treatments for COVID-19 and new treatments for cancer need to be celebrated. So I'm glad we're doing that today. But it's also important, as a physician myself, to recognize that the medicine sitting on the shelf or in a patient's, in the bottle still in a patient's medicine cabinet doesn't result in new health or improved health or relieve any suffering. We need care delivery that is both accessible and affordable for all Americans. People deserve to be offered effective care and care that is delivered safely. And as the pandemic has underscored, we need to ensure that care and outcomes are equitable across all racial, ethnic, socioeconomic, geographic, and any other groups we can think of. In my mind, biomedical and health system research are the engine and the transmission of the healthcare chassis. We won't get far without both of them. So my colleagues at ARC recognize that at the same time the nation invests in research to discover the medicines and treatments of the futures, there's a tremendous amount we can discover about how to ensure that all the tools we already have are being used to improve health now, and that we're prepared to integrate new innovations when they're developed.
Yeah, no, that's great. And I'm so glad that you emphasize the role of equity and addressing this nation's deep disparities in can we all get access to those biomedical innovations, whatever our diagnosis, whatever our need? You also mentioned the pandemic, and in fact, the interplay. I mean, the progress we've seen on patient safety. I don't know if you saw there was a headline in some newsletter this week about how actually hospital-acquired infections have gone up during the pandemic because so many patients are intubated because of just the complications from the pandemic. So it's all connected.
Can I just go on that? So I did see that. And I think what that's showing us is that the pandemic was like a stress test on the healthcare system. Doctors take patients who might have heart disease and run them on a treadmill. So even though they're doing well, when you put them on a treadmill and have people work harder, you stress them and you can see how well their heart's working. And the pandemic did that for our healthcare system. And we need to go to cardiac rehab. The healthcare system needs help. That's what we saw. The infections went up because we had low staffing rates and we had people working long shifts and there were more sick patients in the hospital. It's a real opportunity to learn from the pandemic about how to improve care. So then even in normal times, the healthcare system will be healthier.
No, that's a great point, the stress test analogy. I love that, David. Unfortunate, but true. So stay with me on this sort of pandemic focus. Biomedical research, as you said, really stepped up and contributed so much so quickly in terms of the vaccines. So what has been the role of health services research in response to the pandemic?
Oh, that's a great question. And I think appropriately, our immediate attention in research focused on the virus itself and methods of transmission and creating diagnostic tests, developing treatments, creating the vaccines, basic biomedical research. But at the same time, public health and clinical health systems used evidence from previous health services research as part of their actual response. ARC itself, we shared guidance that we had developed in the past from Katrina, from Ebola, about standing up temporary hospitals, about training staff on putting on and taking off their personal protective equipment, and even some of the first research available about how to use telehealth safely. We also sprung into action using our long-term relationships with academic health centers, large health systems, and quality improvement organizations so that in less than 3 months, we were able to launch a national nursing home COVID-19 action network, which in the end consisted of 99 training centers that were able to work with over 9,000 nursing homes in every state in the country, District of Columbia, and Puerto Rico that provided customized training and mentorship to improve the safety and residence of staff. And that's about quality improvement and safety improvement and taking what's known and putting it into practice. But at first, it was really difficult to layer on new health systems research during the initial surge. Systems were just going full out. But after the first several months, we at ARC, along with Pecori and others, were able to begin investing in evaluating the response of the healthcare system to the pandemic. We want to learn what should be continued, what should be used in future emergencies, and where are there still unsolved problems. I'd love to give you a few examples. We funded about 25 rapid cycle COVID-related research grants just this year. One of them, as the pandemic made clear, effective screening, testing, and treatment during the pandemic really challenged healthcare system. They were reeling from surges, from the workforce shortages, and from financial strains, all while they needed to do both their usual care plus this new pandemic-based care. And so we partnered with the University of the Medical University of South Carolina, actually, MUSC, to take a systems approach to understand how innovations, both in South Carolina but across the country, leveraged both telehealth and informatics data in order to create a continuous system of screening, testing, contact tracing, and then treatment. So we're really looking forward to seeing what they're going to learn. We also know that the pandemic disproportionately impacted the elderly, people of color, and underserved communities. So another one of our grants that we're very proud of with Alterum, which is a nonprofit research group, is looking at evaluating emerging best practices among the PACE programs of all-inclusive care for the elderly in response to COVID-19. And this may be one of the few true silver linings. If we can learn from the pandemic how they improved care for vulnerable adults during the pandemic, what that'll mean going forward. So I'm looking forward to that. I think we all agree the pandemic has changed how healthcare will be delivered in the future. The question now is whether we can harness health services research to make sure that those changes lead to quality, safety, equity, and value.
No, those are some great examples. Thank you, David. So, as you know, Academy Health is the home for the Friends of ARC, and we have been advocating for substantial increases in your budget. What bold new initiatives could you support if you had additional funds? I mean,
that is a wonderful softball question. Thank you, Lisa, and thank you for all the work you're doing for ARC. But I think you know, but I'm not sure everyone else knows, that for every study we're able to fund, we're forced to leave many other ideas on the table simply because of lack of resources. Our pay line, the cutoff point for funding of grants, has fallen from about 20% several years ago to now less than 10%. And this year, for non-COVID related grants, it may be as low as 6%. The pay line is dropping not because of lack of funds, but because we are receiving so many great applications. The quality and the areas that they want to do, it is just the saddest part of my job is having to say no to some of these answers. And there is no doubt in my mind that there are important questions in need of answers. So to answer your thing, can we both be bold? Absolutely. Let's start with what we were just talking about. We should immediately be investing much more in evaluating what worked and what didn't work in healthcare delivery during the pandemic. And we have to remember that the answers to this question is not going to be the same for care in rural Wisconsin or New York or the Mississippi Delta. We need a diverse portfolio of research. I'd also like to see us focus on how we can build a more resilient healthcare system. We need to be prepared to deal with future crises. This can't happen again just like it did this time. We have to be prepared for the next pandemic or climate change or any other threat to health that comes forward. And finally, sticking with the COVID, I think we need to start investing in discovering the ways to care and organize care and deliver care for the many, many people who are going to live with long COVID. There's a long tail to this problem. So if I can keep being bold, a second area I think with enormous potential is for health services research on the rapid expansion of telehealth. We recently awarded a grant to the Kaiser Foundation Research Institute to examine how patients are choosing, how they themselves are using telemedicine in their own care. And this research is going to give us evidence to inform reimbursement policies, technology adoption, and all sorts of systems, not just the world of Kaiser, and the real world use of telehealth by patients and providers. We've also funded other grants that are exploring how telemedicine can improve transitions from hospitals to long-term care facilities, specifically focusing on the issue of improving medication reconciliation, and how speech therapy can be done remotely using telemedicine for people recovering from strokes. But similar to what I was saying about COVID evaluations, there are so many more questions we need to address. I could go on, and maybe I'll just skip on that. But I really believe that the sooner we start investing in this research, the better.
Telehealth is just the innovation that's happened so far. digital health that you're also investing in. There are newer and more digital health opportunities beyond telehealth that you're studying or could study.
They're both. Telehealth is just one piece of that larger digital health ecosystem. Healthcare is not going to be the same. It shouldn't be the same, and it can be better. I agree. I know my colleagues at ARC would be upset with me if I didn't point out they are chomping at the bit to invest in new models of primary care and improving care for people with multiple chronic conditions. This is something we've invested in for a long time, but now is the time to go further with this. These are the people that rely most on care. They use the most medications, they utilize the most healthcare services, and are the people most likely to benefit from biomedical innovation. We all will do better if we're able to build a healthcare system that cares better for these folks. I'd like to also to invest more research in improving the quality and the accessibility of behavioral healthcare. That's both mental healthcare for adults and children, also substance abuse care, and probably that also should be tied in with a strong primary care platform. And finally, I'd be remiss if we didn't talk about how delivery systems are making investments in addressing equity, and we need to help them evaluate what's working for who and which things are working less well, and so that they continue to make the best and most valuable investments to address equity. So is that bold enough? I'm happy to keep talking more. I'd love to hear what you're saying. I'd love for the people listening to us today to also write in and help us chart that bold initiative future.
Wow, David, those are some great and important and relevant studies that we really need answers from. So I am really excited about the opportunities that ARC has to really contribute to the research that will make healthcare truly better in this healthcare system that is so shocked and stress test right now. So thank you, David, for joining us today. It's been a great conversation. And I want to again thank Research America for this fantastic forum and all that you do in between these annual forums to make research a priority for our country. Thank you.
Well, thanks for the invitation.